It's a beautiful day in the city of Lagos, and I am at Ikeja GRA. My name is Kike Lomo Odiebo, welcoming you to Community Feedback on Lagos Television. Thank you for joining me today. Wow! Today on Community Feedback, we shall be celebrating the success story of the program Save 1 Million Lives Babies in Lagos State, and the program came to an end in January. But this report has been put together to chronicle the activities from 2017 to 2021, and that's what I'll be showcasing on Community Feedback today. Do you want to know the details? Join me in a moment. Reports say Nigeria's maternal mortality rate is still among the highest in the world, with an estimated 512 deaths per 100,000 live births, which is a far cry from the Sustainable Development Goal target of 70 deaths per 100,000 live births under the SDG Goal 3, Good Health and Well-being. A statement published on the World Bank website says the World Bank released $500 million to improve maternal and child health, achieve the Saving 1 Million Lives program in Nigeria. The federal government, through the Ministry of Health, then launched the Save the 1 Million Life program on October 2012 to save the lives of more than 900,000 women and children who die yearly in Nigeria from largely preventable causes.
SOMLP4 has been a federal Ministry of Health initiative, and it was actually launched in the year 2012. Mainly due to the fact that poor health outcomes, or let me say poor health indices, were being noted by the Federal Ministry of Health.
Using the funds provided by the World Bank, the federal government and the state government through the federal and state ministries of health were expected to achieve the Saving 1 Million Lives program.
The Yoruba people have a saying there that Maluti Oniru Olon Lomba Leshinshin. These slums are areas where the Malus that don't have Iru exist, and someone needs to take care of them. They cannot put together enough money themselves to pay for health insurance. And yet, because of the conditions under which they live in, they're one of the ones most prone to illnesses, even worm infestations, poor nutrition, issues like malaria, because with slums comes a lot of mosquitoes and stuff. So all those things, they have the highest incidence of disease and illness, and yet they're the ones least able to afford it.
Here in Lagos State, the Commissioner for Health, Professor Akin Abayomi, said the Saving 1 Million Lives program was able to improve the health indices of Nigeria, especially as Lagos State targeted poor and vulnerable populations trapped in urban slums and hard-to-reach areas where there are significant health access gaps.
Lagos is very committed to delivering universal health coverage. It's an intrinsic part of Governor Babajide Sanwo-Olu's mandate. As you know from themes, the emphasis is on primary health care, universal health coverage, and creating safety nets for much of Lagosians who are close to or on the border of being considered underprivileged. So the SOML program, which stands for Saving 1 Million Lives, is a federal government initiative that's supposed to help states improve on their ability to deliver universal health coverage across majority of the health parameters that people in Lagos, in things like immunization, protection against malaria, family planning, and nutrition.
The Save the 1 Million Lives program has 6 pillars of maternal and child health services for better health outcomes in Lagos State. Through vaccination coverage, family planning, nutrition, expansion of maternal health services, elimination of vertical transmission of HIV, and malaria control. In 2022, Lagos State unveiled its Program Implementation and Closure Program 2017 to 2021 at a close-out ceremony of the Saving 1 Million Lives for program and reports. For us in Lagos State, we feel we have still not done better. We can do better than this. That was why we sent a benchmark.
The national average is actually at 70-80%, but Lagos State actually sets a target. We put our own target at 95%, and as we speak, we are at 81%.
A GPS app for identifying over 200 public healthcare centers was also presented to the public as Lagos continues to bridge the equity gap at the primary healthcare level through improved technology-facilitated system. One of the key recommendations at the close-out ceremony is that structure should be put in place to factor in major private sector investments in the state's primary healthcare sector.
Government generally cannot do everything, but in private practice, you have quite a lot of things that we do, and yes, we are in partnership with them. And all these things, when we do them, by the time you congregate all of them together, you will find out that there will be even a tremendous improvement in all these indices.
Meanwhile, many of the beneficiaries of the Saving 1 Million Lives program between 2017 to 2021 expressed satisfaction at the quality of care given to them free through the Ilera-Eko health insurance scheme of the state government.
I think Lagos State has set the blaze, in terms of really, first of all, accepting the program. Secondly, articulating the program and activities that will see to the improvement of healthcare in Lagos State. Thirdly, is Lagos State actually consummated the program to the extent that they regularly review successes and challenges in the program. And that's what has brought to the situation where Lagos has achieved a lot, particularly in the area of maternal, newborn and child health. And as Lagos is running up this program, they also developed the GIS mapping of all the primary healthcare facilities in the state.
This comes as Governor Babajide Sanwo-Olu's administration pledges more investment in the health sector towards making healthcare services qualitative, affordable and accessible for everyone, especially mothers and their children, to improve the maternal and child health indices of the state.
Next on our program is our Vox Pop segment, where we spoke with beneficiaries of the Save 1 Million Lives program for results in Lagos State. And it will be interesting to know that 2 couples actually had twins and they enjoyed free healthcare delivery services courtesy of the Save 1 Million Lives program in Makoko community, a community that has been identified as having many poor and vulnerable households.
1 Million Life program, we are really proud of it, and we thank them very much for what they are doing in my community at the Boy area. So let's say thousands of it are benefit from it, and they thank them so much for what they have done for them.
My husband came and my relatives, so they put an in the book. So they signed, and
what now happened?
So after that, the CS was done, and I'm happily with my twin.
Thanks to the Save 1 Million Life, which is SOML. Just we did, just walk into the community and then asking that we should come and register. Then we just feel like, okay, let me register. After registering, then I said, okay, which hospital did I choose that I like most that I should go? I said, well, I prefer that they should not take me to a far place because of the money. Because we live in a slum area, there is no money to take care of the children. But if they can look for a closer place to me, and they say, okay, fine, which place is very closer to us? They should put me in Cottage Medical Hospital, which is at Iwaria, which is Secretary. And I said, okay, the transport to there is 100 naira. They said, is that okay for me? I said, yes. After taking my details, my name, my wife's names, after taking them, then later we now look like a month. They just now come to the community back. Okay, your name is out. I said, my name is out. I just checked my phone. I saw a message. I just see a serial number. said I should just go up to the hospital and then give them the phone, then they will just attend to me. From there, gradually, little by little, then the pregnancy began to develop from 1 month, 2 months, 3 months, 4 months, 5th month, 6th month, in the 7th month, then 8th month and 9 months. Then after the doctor examined her, the doctor now later he said, do you know that your wife will not be able to deliver through normal delivery? I said, what happened? Why? He said, well, we have to do CS. I said, CS. You know that the CS money is, he said, it's about 350,000. I said, I don't have that kind of money. I can't afford it. He said, well, you are not going to pay. So far that SOML is there for you, that they have already paid your money. What we just need for me to do is for me to just put my hands in the paper that scale. I agree that they should carry on this CS.
When I service 1 million, you are that Benami town. They move here, let's see, and do my Kalome Quemanti. The name of the Togo Fili, you know, the Togo Von, well, why? You told me town, you are that Benami. Dokuna is super. I take one town. Kaka and the Jivia Wele. You were then a to Maya. No, you finish. You don't do Ghana.
Aside the program implementation and closure report launched for the implementation of Lagos State Save 1 Million Lives program for results in Lagos State here in this hall, another presentation was made of the GSI mapping so that those looking for how to locate public healthcare facilities in Lagos State will have easy access identifying that. I spoke with the program coordinator, Dr. Mazidat Eriosho, and here is what she has to say on the benefit of such presentation.
The benefits of the geographic information spread of public health facilities. We realize we have over 300 public health facilities in Lagos State, but a lot of even our people within the community don't even know most of these facilities actually resides in their domain. A lot of them are like, I'm looking for this PHC, and the PHC is actually close by. So what we did was, let's even have a comprehensive list of most of our public health facilities on Google Map. And what Google can upload is, one, is this facility, does it have a signage? So a lot of them actually pass in front of a facility, they don't know it's a primary healthcare facility. Maybe they are not seeing any health activities going on there. We've had situations where people are asking, I live in Ikorodu and I want a PHC that is close by. So at a glance, if you look at that map, that was why we made a hard copy, a printout, so that any locality you find yourself in Lagos State, across the 20 LGAs and 37 LCDs, there's a primary healthcare center in that domain.
Wow, it is mind-boggling to hear from Dr. Kana that this Save 1 Million Lives program for results actually started without attracting any financial controversies from ICPC or from EFCC. In other words, the program had been designed to fit the aim of all of the stakeholders that worked towards achieving it, both at the federal level and also at the state level. Well, kudos to Lagos State government and kudos to everyone that has helped towards the implementation between 2017 to 2021. That's our program today. Thank you so very much for watching it. Stay safe and see you next time.
This is Lagos, you know we love it. This is Lagos, you know we like it. This is Lagos, you know we love it. This is Lagos, you know we like it. This is Lagos, you know we love it. This is Lagos, you know we like it. You know we love it. This is Lagos, you know we like it. This is Lagos, you know we love it. This is Lagos, you know we like it. This is Lagos.